So we are going to just start with the chapter number 3, that is the pectoral region. So pectoral region, it is actually the front of your chest. Very important, see, this is the pectoral region. Important thing about this is that the area that is covered by the pect major muscle, it is actually forming the pectoral region. And as you know, the pect major muscle, it is medially attached to the sternum and laterally it is attached to the humerus. So your pectoral region attaches your upper limb, to anterolateral chest wall. So your upper limb or the arm is connected to your anterior, this front portion, and lateral a little bit towards the side. So this arm is connected to your anterolateral chest wall via the pectoral region. Going towards certain surface landmarks, first of all we have clavicle. So you can see this clavicle lying horizontally. Then we have the jugular notch. This area between the two clavicles, this is the jugular notch. 5 centimeter below the jugular notch, we have this area which is known as the sternal angle or angle of Louis. Very important because it is used for the numbering of the ribs. Second rib lies at this level. Then we have epigastric fossa. So you see this area. This is the area of epigastric fossa. When you divide your abdomen, this is the middlemost area of your abdomen, the epigastric fossa. Then you have this important area which is the nipple. Nipple is 10 centimeter from the midline. So it is having a 10 centimeter gap from the midline. Midline is the area of sternum. So 10 centimeter from the midline in the fourth intercostal space. Between the fourth and the fifth rib, we have the fourth intercostal space. That is the area where your nipple actually lies. And mid-clavicular line, between the two ends of clavicle, between the medial and lateral end of the clavicle, in the middle of the clavicle, we have the mid-clavicular line. It passes to the middle of the clavicle. Then at this area, at the tip of the ninth costal cartilage, and then it passes through the mid-inguinal point. Mid-inguinal point is very much important when we'll go towards the upper lip, but you need to know that mid-clavicular line passes the middle of the clavicle, the tip of the ninth costal cartilage, and going downwards, it passes through the mid-inguinal point. Then we have the infraclavicular fossa below the clavicle. Infra means below and clavicle is clavicle. So infraclavicular fossa. Then we have this coracoid process of the scapula. This acromion process of the scapula forming the acromioclavicular joint. Then we have the deltoid muscle which will cover this area, the deltoid muscle. Then we have the axilla or the armpit region between, this is the anterior fold of axilla, this is the posterior fold of axilla. So these are two folds. Between these two folds, we have the axilla. And between the two folds of the axilla, we have the mid-axillary line. It is also very important surface landmark. So now coming towards this important thing, which is the superficial fascia. As you know, every organ of your body or everything of your body is covered by your skin. Beneath the skin, you have your superficial fascia, then your deep fascia, then there comes your muscles. So you have your skin, then your superficial fascia, then your deep fascia, then comes your muscles. So this superficial fascia, it is like a band and it is fatty. It is having moderate amount of fat, and the breast also lies in this region of the superficial fascia of your pectoral region. And fibrous septa given off by the fascia support the lobes of the gland. The gland, that is the main mammary gland, it is divided by the fibrous septa and the skin covering the gland. This is about it. And contents, the superficial fascia of the pectoral region contains these content. First of all, it contains cutaneous nerves. Every fascia is always innervated by some nerves. These nerves are cutaneous ones, and these nerves, since this pectoral region, as you can see over here, this pectoral region is related to your, the nerve supply will be coming from your cervical region, from the cervical vertebra. So you will say that the nerve supply is coming from the cervical plexus. and also it is between the ribs, so intercostal nerves and cervical plexus. So after being supplied by the cervical region, then that was the intercostal nerves. We have another thing, that is cutaneous branches from internal thoracic artery, thoracic nerves. So this anterior cutaneous nerve, which is written over here, is actually internal thoracic nerve. Remember that always. And certain posterior intercostal arteries will also be there. This is a muscle platysma, which I will be showing you in a moment, and the breast will be in the superficial fascia. Now, the cutaneous innervation of the pectoral region. What is this cutaneous supply of this region? So, look at this diagram, which is very much important and very easy. Now, I will explain it to you. So, this is the anterior cutaneous nerves. They are from T2 to T6. They will supply the region towards the sternum. These are the supraclavicular nerves. So you need to remember the landmarks. This was the clavicle. So supraclavicular nerves will be supplying the area of the clavicular region. This is the sternum. So anterior cutaneous nerves will be supplying this region. This is the lateral region. So the nerve supply will be lateral cutaneous nerves. And this region, which is actually your arm, and the Latin name of arm is brachium. So intercostobrachial nerve, that is connecting your pectoral region to your upper limb. So this is intercostal nerve. So your pectoral region is supplied by intercostal nerves, and this is your brachium. So it will be known as intercostobrachial nerve. So lateral cutaneous nerve, the anterior cutaneous towards the sternum, the supraclavicular at the region of clavicle, and intercostobrachial connecting your intercostal spaces to your brachium or your arm. Very easy. So towards the medial side, the supply will be from T2 to T6, whereas towards the lateral side, the T2 region will not be supplying, rather T3 to T6 will be supplying. This is easiest explanation. So now they are talking about the cutaneous vessels. Vessels, they include veins and arteries. So these vessels that will be supplying over here, they are saying that the arteries which will be accompanying the anterior cutaneous nerves, they are the internal thoracic artery, inner thoracic or internal thoracic artery. So they will be internal thoracic, and the second one, third one, and fourth one of this region will be supplying your breast. Second, third, and fourth of these branches will be supplying the breast in the females. So internal thoracic over here. Towards the lateral cutaneous nerves, the artery coming there would be posterior intercostal artery. Towards the lateral cutaneous branches, we have the posterior intercostal artery. So in this region, the internal thoracic, in this region, the posterior intercostal arteries from lateral cutaneous branches. So nerve was anterior cutaneous, artery is internal thoracic. Nerve was lateral cutaneous, artery is lateral cutaneous branches of posterior intercostal coming from the back side. This is connecting your pectoral region to the brachium or arm, so intercostobrachial. This is towards your clavicular region, so supraclavicular. Medial side, the supply was from T2 to T6, whereas lateral side T2 is not giving. It is from T3 to T6. So look at this muscle. Now they are talking about the platysma muscle, which is arising from the clavicle. Why is it important in the pectoral region? Because it is going to cover your deep fascia. It is connected with the deep fascia of the pectoral region. So this platysma muscle is having its origin from clavicle. As you can see, insertion is going to be on the mandible. Then it is from the deep fascia over the pectoralis major. Rather, the main thing over here is the deep fascia, which is connecting here. Main origin is from the clavicle, but second origin or secondary origin is from the deep fascia covering your pectoralis major muscle. And origin is clear. Now we go to the insertion, which is on the mandible. Nerve supply is via the facial nerve. So see, it is connected to the facial bone or the mandible. So nerve supply is going to be facial nerve. And action, very much important, is the action. It depresses the angle of your mouth. Always know that your muscle is pulled from your insertion towards your origin. So, insertion origin will pull the insertion downwards. So, there will be depression of the mandible and the angle of the mouth. Your mouth will be opened, your mandible will be depressed downwards. Now, look at this diagram. This was your platysma muscle, which was attached or inserted into the mandible. The main feature of this muscle is to protect this nerve. And it is not even a nerve, it's a blood vessel. And which blood vessel is it? It's a vein. And which vein it is? The external jugular vein. So your platysma, this broad muscle, will protect your external jugular vein when your mouth is being opened or your mouth is being closed when you talk. So this external jugular vein. Now we look at this diagram, which is your area supplied by cutaneous nerves. Why am I explaining this cutaneous nerve again and again? Because it is very much important and it will help you to understand the nerve supply of the muscles of this region. So this is the C3 region, this is the C4 region, cervical plexus, okay? The C5 to T1 goes to your brachial plexus that we will talk about in axilla. Then your T2, T3, T4, T5 and T6. These are thoracic nerves. So in this your pectoral region, the supply will be from C3, C4, two of these, and then from T2 to T6. Always remember C5 to T1 will go towards your brachial plexus. And this is your cervical plexus, this C3, C4 region. So now we come towards the most important element that is placed in your pectoral region in the superficial fascia of this region, which is known as your breast. It is rudimentary in males, but it is highly developed and highly functional and contains glands in females. It can have a lot of shape such as hemispherical, conical, pyriform, pendulous or flat. And always remember the development of the breast is under the action of hormones, and they are the female secondary sex characteristics. Situation, okay, so it will lie in your superficial fascia of the pectoral region. Now the breast is divided into four quadrants. As you know, I have done this division, and since you know this is the clavicle, always identify this is your sternum. So this will be the upper region, and this is towards the midline of the body, so this becomes upper medial region. This one is a little bit laterally, so upper lateral region, upper medial, upper lateral. This one is going to be lower medial, this one is going to be lower lateral. Now in the upper lateral region we have a certain something going outwards, which is the axillary tail of Spence, and it passes through a opening in your deep fascia, and this opening is known as the foramen of Langer, and this opening is circular, from which your axillary tail of Spence leaks out from the upper lateral quadrant of your breast. Now this breast lies from the second to the sixth rib. So it is from the second rib towards the sixth rib. Okay. Horizontally, it extends from the lateral border of the sternum to mid axillary line. You know, I told you about the surface landmarks. In the surface landmarks, we studied about anterior axillary fold, the posterior axillary fold, then the mid axillary line. Now, from laterally, the breast lies from the mid axillary line, and medially it lies to the lateral border of sternum. Now to explain the deep relations, I will show you a very nice diagram. So this is your diagram. Also remember that the breast is situated in your superficial fascia. So beneath the breast will be your deep fascia first of all. As you can see over here, they are saying deep fascia, that is below the breast. Now three muscles are there. First of all, we have this muscle which is pectoralis major muscle. Then we have this muscle which is serratus anterior muscle, this saw-toothed muscle. Then we have this external oblique muscle of abdomen. So three muscles, namely the pectoralis major, the serratus anterior and the external oblique muscles of the abdomen. Beneath the breast is also the deep fascia as well, and it is located, the breast itself is located in the superficial fascia. Now also look at this figure, and you can see this is the superficial fascia then you have this space, then comes your deep fascia or the pectoral fascia, then the muscle. So what is the space between the superficial fascia and the deep fascia? The space lying at the level of the breast is known as the retromammary space, and this is made up of loose areolar tissue. The main function of this is to allow the breast to move on the region of your to move on the deep fascia. The main function is movement. Now we'll talk about the structure of the breast. Always remember, it is having skin, the superficial fascia, beneath it the deep fascia. So what is having actually is the skin, then there's parenchyma. P is for parenchyma and S is for stroma. So S also resonates with something else. S also is the starting letter for supporting structure. So stroma is your supporting structure, whereas parenchyma forms the functional part, and skin is actually covering it, and skin is also known as epidermis. So as you know, in the surface landmark thing, I told you that your nipple, it lies 10 centimeter from the midline. So it was your midline, and nipple was in 10 centimeter from the midline at the level of fourth intercostal space. Okay, so this is the nipple which is lying in the skin. First of all, that is region. Now we have something else. We will look at the diagram to understand that. First thing is your lactiferous ducts, then your lactiferous. So look at this diagram. So your nipple, which was lying 10 centimeter from the midline, nipple has the opening of the lactiferous ducts. Then these ducts have lactiferous sinus beneath them. This sinus is actually the collection point. Behind these sinuses, we have lobes. There are 15 to 20 lobes. So we have lobes. Lobes open into sinuses, and the sinuses, they open into ducts, and the ducts, they open into the nipple area. So your skin will consist of your nipple as well as your lactiferous ducts. Okay, so now the mammary gland. What is the mammary gland? That is your parenchyma or the functional region. It is a tubulo-alveolar gland. This is tube shaped, and the acini, they are alveolar shaped. You know the tubulo-alveolar glands, you can study them in the histology lecture that I have given, and I have made a playlist over there, the foundation module histology area. Okay, so these are tubulo-alveolar glands having 15 to 20 lobes. Within the lobes, there are alveoli or acini, and they open into the lactiferous sinuses. Sinuses, the collection point, and these sinuses drain into the lactiferous ducts. Simple as that. The parenchyma region is complete. Now we have the stroma or the supporting framework, which is also given over here. The supporting framework is actually the suspensory ligaments of Cooper. These green regions, these supporting structure, these are the suspensory ligaments of Cooper. They anchor your superficial fascia in which the breast lies. They connect these to the deep fascia or the pectoral fascia. You can see this region, they are connecting back to the green line. This green line is actually your pectoral fascia or deep fascia. So supporting framework connects your tubuloalveolar gland back to your pectoral fascia or the deep fascia. And this is the retromammary space. The main function of the space was to allow the breast to move over your pectoral muscle. To understand the blood supply of the breast region, okay, we have this very nice diagram. I told you that in the pectoral region we had this sternum, we had this clavicle. So towards your sternum, I also told you there will be the arteries. These are internal thoracic arteries. So they are perforating branches of internal thoracic which will be supplying your medial region. Then towards your lateral region, we have the lateral branches coming from posterior intercostal arteries. Then we have this region. This is your axillary artery actually. Axillary artery will provide different branches. First of all is superior thoracic artery, superior one, then is acromiothoracic artery, then is lateral thoracic artery. So superior one, lateral one, and acromiothoracic one from the axillary artery. So you can say superiorly it is supplied by axillary artery, medially it is supplied by internal thoracic artery, laterally it is supplied by posterior intercostal artery, but its lateral branches. Simple as that for blood supply. So now to understand the vein region, I have this very nice diagram. So in your neck region, the veins, they will drain into the superficial veins of the neck. The thoracic region, the medial side will drain, the superficial veins of the medial side will drain into internal thoracic vein. So this is internal thoracic. Internal means on the inner side, thoracic in the thoracic region, so internal thoracic vein. This is how you can remember the name. This will be the vein of the neck. Then your deep substances, they will go to your axillary vein. So this is your axillary vein. So deep substances will drain into the axillary vein and sometimes into the posterior intercostal veins. So the posterior intercostal veins, they are coming from backside. So superficial into the superficial veins of the neck and internal thoracic. Deep one into axillary and posterior intercostal veins. So look at this very nice diagram in which you get to know the nerve supply of your breast. So it will be supplied mainly by 4 to 6 thoracic nerves. So which thoracic nerves are going to be there? So on the medial side, so always we identify the sternum over here, clavicle over here. So on the medial side, it will be supplied by anterior cutaneous nerve. On the lateral side, it will be supplied by lateral cutaneous nerves, and the number will be from T4 to T6. Okay, some supply on the superior side can be given from the supraclavicular nerves. This is the nerve supply of your breast. So now they are saying over here the anterior, the lateral cutaneous branches from 4 to 6 region. Okay, so now autonomic fibers are given to smooth muscles. Why? Because the breast has mainly smooth muscles and it is under the control of your pars anterior, which is a type, or which is having a part the hypophysis cerebri, which will secrete the hormone prolactin, which will cause the milk production. Then then the milk will come. Then prolactin will act on these tubuloalveolar glands. On the synaptic glands, the milk will start to be produced. Then it will go towards the lactiferous sinuses. Then the sinuses will open into lactiferous ducts, which will open to this region. So I was talking about this region. This is actually your pituitary gland, and pituitary gland has this region, the pars anterior. So the pars anterior region of hypophysis cerebri, that we sometimes call the pituitary gland hypophysis cerebri. So this pars anterior region of your pituitary gland will secrete the hormone prolactin, which will go into whatever I have explained before. So now we come towards the lymphatic drainage of the breast. This is very important. So let us see on the medial side, these are lymph nodes near your breastbone or your sternum. So these lymph nodes, they are known as the anterior thoracic or parasternal lymph nodes. Okay, anterior thoracic or parasternal lymph nodes. This above the clavicle, this is supraclavicular lymph nodes. Now, these lymph nodes in your armpit or your axilla, they are divided into anterior group, the posterior group, the lateral group, and the central group. Anterior, the posterior, the lateral, and the central. And connecting these nodes, you see these dilated portion, these are nodes, and between the nodes there are linkages. These linkages are known as vessels. So this is how your breast is drained. Now there are certain other ones which I will show you by the name. So major lymph nodes, the axillary one, the main one was anterior, then the posterior, then the lateral, then the central, then anterior thoracic or parasternal towards your midline. Then some lymph from the breast also reaches the supraclavicular above the clavicle as I showed you. Then the cephalic or deltopectoral, these will be on your deltoid muscle. Then posterior intercostal nodes, they will be lying on the heads of the ribs. And remember, ribs, they have their heads on your back side towards your vertebral column. So ribs have the heads on the back side connected with the vertebra, this region. So the posterior intercostal nodes will be over there, and subdiaphragmatic below your diaphragm, and subperitoneal below your peritoneum cavity. Peritoneum cavity is the region where sometimes we have dialysis, the peritoneal dialysis. Remember that. So, main one is axillary. It is involved in carcinoma of the breast as well. On the medial side, the anterior thoracic or parasternal one. Then, on your neck region, the supraclavicular ones, and the secondary ones, they include the subperitoneal, subdiaphragmatic, and posterior intercostal, and sometimes on the deltoid muscle, the cephalic nodes. So also look at this diagram. Since I want to clearly explain everything, so I'm going to various diagrams. So these are internal mammary lymph nodes. This is the anterior group of axillary. This is the posterior group of axillary. This is the lateral group of axillary. This is the central group of axillary. This is the apical group of axillary lymph nodes, and this is the supraclavicular one. Below your diaphragm, you have subdiaphragmatic. In the peritoneum, subperitoneal. In the region of your deltoid, the deltopectoral ones or the cephalic ones. So different are there. So now we come towards the distribution over here. So breast is divided into four quadrants over here. So this is the upper lateral quadrant. And as you know, this is the upper medial quadrant. And as you know, on the medial side, you have the parasternal or anterior lymph nodes. The medial quadrant drains into internal thoracic group of the lymph nodes 20%. So medial side goes to the internal thoracic or parasternal lymph nodes. The lateral side, the lateral quadrant, it goes into the axillary lymph nodes, and this drainage is 70%. Medial drainage was 20%, lateral drainage is 70%, mainly into the anterior axillary lymph nodes. Now the posterior axillary lymph nodes that we studied on the head of the ribs, the posterior intercostal ones, they will drain 5% of your region. So 20 on the medial side by parasternal, the lateral side is supplied by the axillary or drained by the axillary one. On the posterior side, you have the posterior intercostal draining 5%, and the remaining abdominal region or subdiaphragmatic region, that is drained by the subdiaphragmatic and the subperitoneal lymph plexuses. Also remember that the superficial will drain everything of your breast except for the nipple and the areola, and the deep veins will do the nipple and the areola region. Okay, you can clearly see written over here. So superficial drains the skin of the whole breast except for nipple and areola, whereas your deep drains the parenchyma, that is your gland, the tissue, and the nipple and areola. So gland plus the nipple and areola goes to the deep plexus, whereas the superficial drains everything except for nipple and areola. Also, they are talking about something very interesting over here, that is a plexus. This is the subareolar plexus of Sapi that I will show you in a moment. This subareolar plexus, it drains into the medial side or the pectoral group of lymph nodes. The pectoral ones, these are the pectoral ones. So this is your nipple region, and this is the subareolar plexus of Sapi, and this will drain into the medial side or the pectoral region. See, the whole area of the breast, the area region, it is draining into the subareolar plexus. And always remember, plexus is where a lot of nerves or vessels or arteries are present. Now I'm going to talk about very important thing, is that the anterior, the posterior, the lateral, they drain into the central one. So you can see the anterior, posterior, lateral drain into the central one. The central one drain into the apical axillary lymph nodes, and this apical then drain into supraclavicular lymph nodes. So 1, 2, 3 drain into the central one, central drains to apical, apical into supraclavicular. Now, which are involved in the carcinoma of the breast? These are the anterior and the central one. the anterior and the central one are involved in carcinoma of your breast. So now how do the breast develop? What happens over there is this milk line of skulls. This is starting from the axilla going to the groin. So this region is axilla and this region is groin, and the ectodermal thickening. So this is actually axilla to the groin, and the ectodermal thickening of this region in the pectoral region causes the development of breast. Okay, and the breast, they have, first of all, they have the alveoli or lobes have the alveoli. They drain into, what am I talking about is lobes having alveoli. They drain into the sinuses open into the ducts. Always remember that. And this development of the breast or the ectodermal thickening, it is mainly caused by hormones, and these female development hormones are known as estrogens, and milk production is done by the prolactin hormone. Certain things we are going to talk about here. Mastia is your breast and thelia is your nipple. So amastia, a means absence, so absence of your breast. Athelia, thelia is nipple, so absence of nipple. Polymastia, poly means many and mastia is breast, so many breast. Polythelia, that is many and that is nipple, so many nipples. And gynecomastia, gyne means female and mastia is breast. So development of breast in male, which occurs in a Klinefelter syndrome, is gynecomastia. So now we come towards the histology of a resting breast and a lactating breast. So resting breast, mainly they are lined by low columnar epithelium. Let me show you. You can see these region, this is having low columnar cells. So epithelium was low columnar, then there will be abundant interlobular connective tissue. So see, this is a lobule and this is another lobule. Between the two lobules you have a lot of connective tissue, and in this connective tissue there are fibroblasts present. So this is fibroreticular interlobular connective tissue. Understood? Fibroreticular in nature. Between the interlobules, so interlobular, that is what it is. And the epithelium is low columnar, and size, the ducts are having different sizes. You see variable sizes, some are large, some are small, and plenty of fat cells. These are adipocytes or fat cells. You can see this over here, this over here, this over here. These are fat cells having various amounts of fats. And lobules are also ill-defined. These lobules, they are not very precisely defined. These are ducts surrounded by lobules. This is interlobular connective tissue, fibroreticular in nature. The ducts are lined by low columnar epithelium. There is a lot of adipocytes present. This is the resting phase, non-lactating or non-milk producing phase. Then we come towards this milk producing phase, in which first thing we see is lobules are very well defined. So you see lobules are very well defined. Now the interlobular tissue or interlobular connective tissue is very reduced mainly. Okay, the ducts are also various sizes, but you can see the interlobular connective tissue is very scanty, whereas in the previous diagram it was very much, now it is very less. There are secretory acini. These are secreting cells, right? And these are ducts which the low columnar epithelium of these ducts has been changed, and now you can see they are cuboidal in nature. Always remember, glandular ones are cuboidal in nature, having less interlobular connective tissue. Secretory acini are present. Lobules are of various sizes and ducts are of various sizes. But the lobules are very clearly demarcated. They have very clear boundaries, distinctive boundaries. Adipocytes or adipose cells are very less in number. I have made another diagram to discuss the pink tables to describe the various diseases of the breast. Now we come towards the deep fascia. So as you know, you had the breast, which was in the superficial fascia. Then you had the retromammary space. Then you had the pectoral or the deep fascia. So this pectoral fascia or the deep fascia, and then you had the muscle behind it, that was the pectoralis major muscle. So the deep fascia covering the pectoralis major muscle, it is the pectoral fascia, right? Supralaterally, it passes over infraclavicular fossa, the fossa beneath the clavicle. This was the clavicle, and beneath the clavicle we had the infraclavicular fossa. So this pectoral fascia will, it is attached to supralaterally, it is attached to the infraclavicular area. On the lateral side, the deltopectoral area, because the deltoid muscle is over there. And infralaterally, it is attached to lateral border or inferior border of pectoralis major. So upper limit of pectoralis major, lower limit of pectoralis major, and lateral limit of the pectoralis major, it is the region of your deep fascia. Now we come to this clavipectoral fascia. Okay, so the clavipectoral fascia is attached on the inferior border of your clavicle. Then it splits in the upper region to accommodate the subclavius muscle. In the lower region, it splits to accommodate the pectoralis minor muscle. Then below it, on the lateral side, we are having axillary fascia. On the lateral upper area, it is being attached to the coracoid process. And on the medial side, always remember it is attached to external intercostal muscle. You will study this muscle when you will study the ribs. So this is medial side, external intercostal. Lateral upper side, the coracoid process. Superiorly, the clavicle splits to form subclavius, then splits to accommodate pectoralis minor. On the lateral lower side, it is now connected to axillary fascia. On the lateral side, you can remember there are bicep muscle and coracobrachialis muscle, which are present on its lateral side. So to explain you people with an other perspective, I have this very nice diagram. So what you can see over here, this was your fascia, the deep fascia or the pectoral fascia, and behind the pectoral fascia you had this pectoralis major muscle. Behind the pectoralis major muscle, this was the subclavius muscle. This was the the pectoralis minor muscle. Major on the front, minor on the back side, the subclavius on the superior side. This was the clavicle. Obviously, the subclavius is below the clavicle. So you know the clavipectoral fascia, it splits to accommodate the subclavius muscle on the superior side. Then it goes downward and encloses the pectoralis minor muscle, and then it goes downward and connects with the axillary fascia. So now I have this very nice diagram to explain to you the contents which are going to pierce the clavipectoral fascia. Remember, again, remember this was the pectoral fascia, this was the pectoralis major muscle, this was the subclavius muscle, this was the pectoralis minor muscle. So this region, the pectoral, this fascia was clavipectoral fascia enclosing subclavius, then enclosing pectoralis minor. So main three things that are piercing this region are the lateral pectoral nerve, the cephalic vein, and the thoracoacromial artery. That is what is piercing this region. Also, one thing that can be asked in Viva is which branch or which cord of the brachial plexus is the lateral pectoral nerve arising from. So lateral pectoral nerve is arising from the lateral cord of your brachial plexus.